Good morning. My study is about the comparative analysis of conventional methods with Maldito for identification of fungal isolates from clinical cases of COVID-19 associated mucormycosis. To introduce COVID-19 has hit the world very hard, especially during the second wave, and India is one of the worst affected countries. Not only COVID-19 cases, there were a rapid increase in the number of mucormycosis cases associated with COVID-19. Only during the month May 5th to July 12th, India has seen 41,000 cases and 3,000 deaths attributed to this infection. This infection is caused by the organisms from mucorales, and mucorales spores are ubiquitous everywhere. But COVID-19 patients are more prone to this infection due to this proposed pathophysiology. COVID-19 is a disease associated with hyperglycemia, and due to the destruction of pancreatic islet cells, there is de novo onset of diabetes, and steroids in turn lead to hyperglycemia. Not only this, the severe hypoxemia and hyperferritinemia. All these factors leads to increased expression of GRP78 receptors on the vascular endothelium, and these are the binding sites for the mucorales COT-H3 receptors. Thus, COVID-19 patients are more prone to this mucormycosis infection. The diagnosis of mucormycosis on a conventional mode requires an experienced personnel and is time consuming, and still the diagnosis can be only up to genus level. So, species level identification has its own limitations, and mucorales are notorious for their rapidity, invasiveness, and interspecies variation in the susceptibility to antifungals. Thus, we need a quicker, reliable method which can identify mucorales up to species level to have a better understanding of the molecular epidemiology and also presumptive antifungal susceptibility more. Malditoff is one such method which has revolutionized the diagnostic workflow in mycology, and it can identify up to species level within an hour of processing. And the results obtained have an accuracy as good as compared to sequencing and often better than the traditional methods. With this background, the aim of my study is to do a comparative analysis of conventional methods with Malditoff for identification of fungal isolates from clinical cases of COVID-associated mucormycosis, with objectives to study the clinical epidemiological features, casual link of various risk factors, and the utility of Malditoff in the identification of various filamentous fungi in CAN cases. The study was approved by Institutional Ethical Committee, and it was done over a period of 1 month, including 100 cases of CAN, which were confirmed to be positive for fungal elements either on KOH or calcofluor mount. The samples received were inoculated onto a pair of SDA agar and DRBC agars, which is a sporulating media, and processed conventionally using LPCB mounts and slide cultures. And out of the 70, 40 isolates were identified by Malditoff. The Malditoff extraction protocol was done according to the manufacturer's guidelines, and a confidence score of more than 60% is considered significant using the VITEC-MS software. Coming to the results, males with a predominant population with 77% and male to female ratio 3.3, and the mean age of the affected population is 47.5 years. And the gap between COVID-19 and onset of mucormycosis mean is around 12.7 days, with a minimum of 3 to maximum of 44 days. Those who presented early, that is less than 10 days, had diabetes as the major risk factor, and those presented late had hypoxia as the major risk factor. All the cases were rhino-orbital mucormycosis except 4 which are pulmonary mucormycosis, and all the patients were COVID-19 affected. Out of them, 14% suffered from severe disease. 72% of them were hospitalized, and 53% of them received oxygen therapy. And diabetes was the most important risk factor associated with this disease, with 97% of the population, and out of them, 49% were diagnosed with de novo diabetes. And 74% of them received steroids, and the mean average dose was around 37.8 milligrams per day, and over a mean duration of 10.6 days. And out of the 30 cases, only 8 suffered from severe. And this value is far above than the recommended guidelines. And serum ferritin, CRP levels were considerably higher in these patients, giving a hint that they could be a potential biomarkers for early diagnosis. Coming to the microbiology on KOH mount, 82% of them showed broad aseptate or possesseptate hypersuggestive of mucorales, and 12% showed mixed infections. So on culture, 70% of them showed growth on culture media, And on conventional methods, Rhizopus was the most common genus identified with 45%. And next to the next common is a mixed infection, and next to it is Aspergillus flavus. And species level identification with Malditov, 40 isolates were identified using Malditov, and Malditov helped in identifying Microsporus being more common, 42.5, and next is Arises, 32.5. So when comparing genus level identification matched with the conventional methods, and Malditov helped in species level identification, Microsporus 17 isolates, Arises 13 isolates, and in Aspergillus flavus, which was conventionally diagnosed, one species was identified to be Aspergillus ochraceus. Aspergillus ochraceus has reported to cause invasive diseases on par with flavors which can cause allergic diseases, and also ochraceus have a considerably low susceptibility to antifungals. So coming to the discussion, males with predominant, similar to all the studies I have quoted here, and the mean duration is a mean gap between the two diseases is 12.7 days, 7 days, correlating with Sain et al. And Mishra et al. Whereas Ramaswamy et al. Quoted 20 days as mean gap. And diabetes is the most important risk factor, 97 in the present study, correlating with Mishra et al. Ramaswamy quoted a lower prevalence of diabetes. Steroids were taken by 74% of the population, similar to Honigge et al. Mishra et al. Has quoted a higher prevalence of 93% of steroid intake. And isolation rate is 70%, similar to Ramaswamy et al. Mixed infections are 11%, similar to Honigge et al. And Rhizopus is most common species, similar to Pal et al. And Honigge et al. And coming to Microsporus species, more common in the present study, similar to Honigge et al. Whereas Chandar et al. Has showed that Arises is the most common species isolated. So with this background, I would conclude that CAM is predominantly affecting the middle-aged and elderly males, and uncontrolled diabetes and steroids were the major risk factors. Mixed infections with Aspergillus is seen in a significant proportion. Rhizopus is the most common genus identified on conventional methods. Malditov helped in species level identification, with Rhizopus microsporus being the most common. Also, Malditov helped in identification of Aspergillus ochraceus, which was misdiagnosed on conventional methods as Aspergillus flavus. Thus, Malditov is a quick and reliable method for species level identification of mucorales, thus helping in molecular epidemiology. These are my references.